So I see that you've returned from the Belarusian front, Sir Bradley.
Him! He's guilty of murdering our Emperor!
So I guess you two are friends, huh? You cocky punk! I don't care how many of you there are. I'll send you all back to the garbage heap you came from.
Forget! Humans aren't at the top of the food chain anymore! Shishio Tsukasa. Pour it on him.
I'll take on all the fighting and the hunting. Not too friendly, are you? What's wrong with hello or I don't know, nice to meet you?
Shut up! Is that blood? Give it all you've got, you little girly boy!
Like he always.
That's out.
The ball!
Because those are the rules of the game. Still out. Be careful how you speak about Miss Honda in the future.
Horiki, a technique which borrows the power of Buddha that monks who've had special training can use. And he told me that I didn't know the basics of self-defense. I thought about it for a bit, and I figured out that defense just isn't part of my fighting style.
Instant! I'll give him a proper burial.
Hey, don't declare me dead yet, monk.
I'm giving you permission. Draw that sword.
Rule number 1. Rule 3. But there is actually one more rule.
He's been sealed.
All right.
How can you still move? Regeneration without weaving signs. I see.
We interrupt our program to bring you this important message.
They're not testing for coronavirus because it doesn't exist. They're testing for genetic material, which many vast numbers of people have in their body as a matter of course. Nothing to do with being ill. And so they're testing positive. And when they test positive for coronavirus, even if they're a late-stage cancer or heart attack or whatever, they will be put down as having died from coronavirus. On March the 20th, the president of Germany's Robert Koch Institute, I'm going to come to him in a second, confirmed that Germany counts any deceased person who was infected with coronavirus as a coronavirus death, whether or not it actually caused the death.
I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
That was from yesterday's White House briefing, and it sparked a nationwide debate over how we count deaths from COVID-19. Do we count someone who tests positive for the virus but died of pneumonia as a COVID death? But what about someone who dies with symptoms of the disease but was actually never tested? It's actually crucial information. According to Professor Walter Ricciardi, is the scientific advisor to Italy's Minister of Health. This is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. Determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit, I read it, what goes on line 1 and then what goes on line 2 and what goes on the final line. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
You reject what he said?
Absolutely. I mean, let's just take someone getting hit by a bus and they collapse along and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
Now, back to our show.
What the hell? Now it's time for you to learn how easy. Cocky boy, don't get carried. You're too slow.
Save me! Someone help!
All the fun! Had enough! And I'm bored again. Hold up. Is that you, Black Rabbit?
Dude, jerk! Do you realize how far you've come?
To the edge of the world, I think.
Isayoy, get out of there!
Idiot! I ain't dead yet! Worm? Aspire to be a distinguished hero like me. Newcomer seminar isn't over yet! In this like this! Again!
No way!
Myself ever approaching Master's power. Not even close.
I heard that!
It's raining out, so let's get this over with.
Mindless reason! Yet what can be expected from a human?
Not again. All it took was one punch.
Oh, I love spring.
Quit your daydreaming! Damn it, he's just mocking us!
Down you go. Okay, boys, I think we're done for now. I'm quite disappointed. Neither of you yet possess the necessary speed. Look, I even signed both of your tops.
What?